In knee arthritis, the problem is the wearing out of the bone and cartilage within the joint. When we've tried all conservative treatment and patients still have debilitating pain, sometimes it's worth considering a joint replacement. In a joint replacement, what I do is make an incision over the front of your knee, and I go down, remove the diseased cartilage and bone, and replace it with metal caps. This is what's called a femoral component. It fits over the end of the femur bone of your thigh bone, and it's cemented in place. And then we have a tibial component here, which is cemented in place on the top of your shin bone or tibia. In between these two components, there's a plastic liner that snaps into place. So again, instead of bone on bone, you end up having metal on plastic. After a typical total knee replacement, patients spend about an hour in the recovery area and then they're admitted up to the joint center. We get them weight bearing as tolerated. We want to get you up and moving as soon as possible with physical therapy. The recovery is quite therapy intense. Requires many weeks, usually about 8 to 10 weeks of physical therapy, really just working on range of motion of the knee. We're working on getting the knee all the way straight and bending it as much as we can after surgery. Typical recovery is painful for a few weeks. We control it best with pain medications in that first couple weeks. It does start to wean off. Usually when I see the patient around 6 weeks after surgery, they're really happy that they had the replacement and things are going much better than they were prior to their surgery. By 3 months, patients are usually doing quite well and are back to their normal activities, but I like to tell people that they're going to continue to improve up to a year after this surgery. Many people suffer from arthritis in both knees and ultimately may need to have them both replaced. It used to be more common to do both surgeries at the same time. We found that replacing both knees put patients at a higher risk of complications such as blood clots and requiring transfusions. So it's generally recommended these days to just do one at a time. Generally, if you have a clean recovery from your first surgery, I would recommend spacing it about 2 or 3 months apart. After knee replacement, I don't put any specific restrictions on my patients. We did the knee replacement to get them back to life, and I want them to do all the things that they enjoy in life. The ultimate goal after knee replacement is pain relief. I want to relieve a patient's pain so they're able to get back to the things that they want to do and enjoy in life.